Jim Howard here in Fort Worth, Texas. Today's date, it is May 13th, 2021. It's 36 minutes after midnight. I think it was last week, maybe a little bit over that I went to my doctor to be checked. And I hadn't really been for a while, and a problem that I've had for quite a while is pain in my left arm in the joint area. Let's see which camera here. Don't think I can really show it to you. It's just here. There is a large lump. Started out as pain a year or so ago, and it got to the point now where it's swollen up gradually. Now and it hurts, of course. Especially, sometimes it just hurts, but especially if I pick anything up, a 12-pack with this arm, pick anything up, a 12-pack of Coke, a 24-pack of Coke, it hurts. I went to the doctor, and it was checked. It was checked, and she said that that of course she could feel it, and she could feel it, but she just didn't really know what it was. She had some possibilities of what it could be, and then she said, well, we better get you a scan on that, and then we'll know more. So they're going to set me up with an appointment to go over to wherever they do their the scanning done and have it scanned. I just woke up from a little nap, and of course my arm was hurting. Actually, what's kind of now, my other arm has had that pain in it for a little bit in that area, that very same area, and now I think I can see the swelling in that area beginning. Maybe it's already there, but I definitely know it's in my left arm, and I think now I have it in my right arm. So I did a search. I'll put the link for this site, by the way. It's kind of neat. You can do other stuff too here. You can drag, and it shows, you can go from bone, and you can start seeing things appear, the layers appearing. And this is what, I clicked on, because that, fits the location and everything. So I did a search. A small triangular elbow muscle connecting the medial side of the ulna to the lateral side of the humerus. And so that's what that is, and that seems to me. So I did a search. Okay, let me go back to, or am I already there? I'm already there. Okay. First, let me drag this over. What is calcium phosphate dehydrate crystal deposition disease, CPPD? Calcium phosphate dehydrate crystal deposit disease is a form of arthritis, which, by the way, I have arthritis bad, that causes pain, stiffness, tenderness, redness, warmth, and swelling in some joints. It usually affects one joint at a time, but sometimes it may affect several joints at once. The symptoms are similar to the symptoms of the other diseases, especially gout, which is why this form of arthritis has the old name of cycle gout, false gout. Some symptoms of CPPD may appear to be symptoms of rheumatoid arthritis or osteoporosis. CPPD commonly affects the knee or wrist. Less often it can involve the hips, shoulders, elbows, knuckles, toes, or ankles. Rarely it affects the neck and causes neck pain, shoulder pains, headaches, and in some cases fever. This occurs when the calcium crystal deposits around the dens part of the second cerebral vertebrae. Now that's talking about, I have arthritis in my neck and everything, but I don't think I have what they're talking about right there for that paragraph. Who is affected by CPPD? CPD affects both men and women. It occurs most frequently in people as they age, commonly affecting people over age 60. I'm 80, by the way. People who have an increased risk for CPPD include those with a thyroid condition. By the way, my thyroid number, I forget what it is. It's higher or lower. I can't remember now what they said. I'd have to look. I think I have lower. Anyway. Now, kidney failure. I'm sure I have kidney problems because of, well, the other things that I have. And I've had high kidney numbers on the lab work and stuff. So it sounds to me like that may be, I don't know if I have low magnesium or not. So I think this is what I have. And so I definitely have swollen joint that is warm and tender to touch. Red skin involving the afflicted joint. I have that too. I can definitely on the left arm see it, but now on the right arm, I can actually see a sort of a red red area in there. Sort of actually in this area here. So let me drag this over. Also, I'll put a link to this below. I'd be interested if you know something about this, if you have it or have a family member that has this or something. I would be definitely interested in your input. Calcium phosphate deposit, CPPD. Let's see, the risk of CPPD greatly increases with age. But it can occur in young people too. Proper diagnosis depends on detecting calcium phosphate crystals in the fluid of an affected joint. CPPD may be hard to diagnose because of the joint pain and other symptoms can mimic gout and other types of arthritis. Diagnosis is confirmed by using microscope to see a small calcium phosphate crystals in the joint fluid. Inflammatory medicines reduce pain of swelling and can prevent or help relieve symptoms of CPPD, but there's no way to get rid of the crystals. So that's about it. I'll keep you posted and let you know what's going on. Oh, it's so great to get old, you know it. just can't tell you how happy I am to be an 80-year-old man. There again, I'll put the links to this and maybe get a little conversation going on, and maybe we'll see what happens. And I'll keep you updated when I have the scan and everything. So, talk to you later on.